Welcome back to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And we love introducing you to a new chancellor. Here with us, we're honored to have Dr. Peter Buckley. He's the chancellor for the University of Tennessee Health Science Center. Dr. Buckley, how are you doing?
I'm doing great, Jeremy. I'm delighted to be on your program and looking forward to having a good conversation with you.
Absolutely. First and foremost, welcome to Memphis. We're honored to have you here in our city. We're going to make you a Memphian, that's for sure. But let's start with a little bit of your background. Before you even get into the medicine, talk about being a native of Ireland.
Yeah, Jeremy, so the cat was out of the bag right at the beginning when you introduced me, because I'm not from around here. I do have a southern accent, but it's Southern Ireland. And I grew up in Dublin, Ireland. I met a beautiful Irish young lady when we were training together in Dublin, and married my wife, Leonie. And I trained as a doctor and then trained as a psychiatrist. And then we had amazing fortune in that we got a green card visa to come to America. A lot of people, you know, they come on a training visa and then they got to go back home and all of that. But we were incredibly fortunate. We basically got a lottery visa, and we were 6 years married, and we took ourselves off to Cleveland, Ohio. And we were like, where's Cleveland, Ohio? And we went to Case Western Reserve University and had the opportunity to work with some big shots in psychiatry there, actually. So very proud of our Irish heritage. We're actually 30 years in America now, just over 30 years. And we're 25 years American citizens. I'm very proud that we have two American, I was going to say children, but they're not, they're adults. I have a son, John, and a son, Brian, and one in Atlanta and the other in LA. And so this country, Jeremy, has been amazingly good to us. And the Irish culture and the Irish influence in America is something to behold when you're Irish. You know, when you go there, as I did, to St. Patrick's Day in New York and see a whole city stopped or watch the river run green in Chicago, or even one time we went to the third largest event in Savannah. It's amazing. It really fills your heart with pride to be both Irish, but particularly Irish in America. There's only a few of us, Jeremy, so just 33 million of us in America.
Only 33 million. You
and
mentioned
I haven't got to know them all yet.
Hey, well, yeah, you got a long way to go, as do we all. So, but, you know, on your end, you mentioned professionally being a psychiatrist, and schizophrenia was and is a big focus. And so talk about kind of that side professionally of working as a psychiatrist, but also obviously focusing and being an expert in schizophrenia.
Yes. So it turns out my parents were doctors, Jeremy, and my dad was a family practice doctor. So I was actually destined to both remain in Ireland, but also take over my dad's practice. So probably never go anywhere other than within a mile radius of where I trained. And then I had my experience in psychiatry as a medical student, and I just kind of fell in love with the specialty, but specifically schizophrenia, because I was interested in the science of schizophrenia. And then I was interested in and remain both appalled and upset by just what a disturbing condition it is, typically affecting young people at kind of the prime of their young adolescence or early adulthood, and then it robs them of a healthy, fulfilling life. It's a treacherous condition. And so I just felt this is what I would like to do as a doctor. And that was why I came to America, because at that time at Case Western Reserve, there were really leaders in the field of schizophrenia research and a whole cadre of international investigators. And so I was very fortunate to get on faculty and then to be involved in research. And I've had the privilege over time to be involved in some of the treatment research, but also in some of the biology research, from looking at some of the chemicals that are involved in the brain that go awry in people with schizophrenia, to looking at the genetics, which we know are very important in terms of the risk of somebody developing this condition. And so I've been fortunate to be able to contribute small amounts alongside other people. And I don't think I'd have been able to make the fulfilling impact if I'd stayed in Ireland, because just the research opportunities and the ability to meet great people that are doing great things in this country, that was very appealing and actually kept me here, and have watched our field evolve over time. I had the privilege about 2 years ago to be on the expert panel for the American Psychiatric Association on the treatment guidelines for schizophrenia, and really establishing what's the state of the art in terms of treatment of schizophrenia. So I found that very gratifying to be able to contribute in some kind of way, because in the end of it all, when you're a doctor, the essence of being a doctor is improving care, whether it's in the clinic with one person, or whether it's through science, or whether it's through administration. At any level, what's gratifying is making a difference. And I've had the privilege of both watching and contributing, and seeing the care for people with schizophrenia and the science improve over time. And now, as I'm a little further on in my career, it's really gratifying to see very talented people, far more talented than I, come up into the field and to develop themselves as investigators and bring all their diversity of interest, opinion, and knowledge to try to crack the nut. Unfortunately, we're still not where we need to be in terms of this condition.
I think that's one of those where I'll have to have you come on and do a Changemakers episode and do a deep dive when you talk about schizophrenia and really even just the advancements and everything. I think that's a fascinating world, just like you're talking about. Switch over and give a little bit of what attracted you, because coming from Virginia Commonwealth University most recently to University of Tennessee Health Science Center, talk about what attracted you to Memphis and this opportunity.
Sure. So, by the way, it's my second tour of duty in the South. So I was in Augusta for 17 and a half years. So I'm used to the heat. I love Southern cooking, and I enjoy Southern culture. And so I did do a stint in Richmond, on the borders of the South with the North, but felt very, very comfortable coming to Memphis. And it was a combination of the opportunity to work at this university. It's a staggeringly impressive university with an extraordinary brand, as you know, not just across the great state of Tennessee, but across America. So that was a real privilege for me in this leadership role, but also for my wife Leonie and I to join the Memphis community. It's a fabulous, vibrant community, culturally vibrant, socially vibrant, but then also to have a degree of integration that I've never experienced before is fantastic.
For those who aren't familiar, I think many drive by the buildings, they see the signage, they understand, the training and the education that goes in, training our future healthcare leaders and professionals. So I think they understand at a basic level, but dive into, when you talk about the
what do they do there?
Science Center, right? Exactly. Like what all, because, in this role as Chancellor, you're the CEO. So what all do you do?
What do we do? So a couple of things, Jeremy. We're part of the University of Tennessee system, which, as I said, is a fabulous university. And there's other campuses, a campus in Knoxville, campus in Chattanooga, new campus in Pulaski. and there's a campus in Martin, and here are we, the health science campus. Now, the reason I say that is because we're a little different, because our focus is on health sciences. So we're engaged in health research, health education, and training tomorrow's and today's healthcare workforce. The reason why I say that, because you could say our campus is in Memphis, but actually we have a campus. We have another campus in Knoxville. We have also another campus in Chattanooga, and we have another campus in Nashville. And we have spread across all this great state, we have over 880 clinical or educational training sites. And they could be in association in someone's practice with somebody who was an alumnus of ours, and our students get to train in that way. So the kind of message that I've been trying to bring is that we're so proud to be in Memphis. Memphis is our home, but really our campus is the entirety and state of Tennessee, because our responsibility for the healthcare of Tennesseans and for training the workforce of Tennessee doesn't reside in Memphis alone. It is a statewide mandate. And we need to make sure that there's great doctors and nurses in Memphis at all the great hospital facilities. But we need to make sure that that's exactly the same in the most rural areas of Appalachia and all across the state, in Middle Tennessee and in East Tennessee. And so we have a statewide brief. We're actually the major provider of health professions, doctors, nurses, allied health professions in the state of Tennessee. We are the state's only statewide public academic health system. And we conduct research as well that is very relevant. We've got projects in terms of looking at clinical trials, in terms of heart health, in terms of other activities that take us all across the state, looking in so many ways to see how can we create new knowledge that then we can translate into care that can make the health of Tennesseans better. So in a nutshell, that's what we do. A large part is training. I mentioned dentists, nurses, doctors, pharmacists, respiratory therapists, nurse anesthesists, a whole bunch of health, respiratory therapists, I meant physical therapists, occupational therapists, all the healthcare people that make up that multidisciplinary team. We train them, and we do so in association with the healthcare providers in Memphis and all across the state, because we couldn't do that without their help. So it's a real partnership.
Absolutely. You and I were talking before we hit record that we have a niece that just had her white coat ceremony as a dentist. And so extremely exciting for her and for our family in terms of what that means. And on my end, I also sit on the Delta Dental of Tennessee board. And so seeing, and you mentioned, kind of the dental deserts, you mentioned some of the areas rural that don't have doctors and dentists and things like that. And so seeing that as a prime opportunity to scale up and provide, the experts to step in, the professionals to step into those areas so that they have healthcare, oral care, all of those providers stepping in. You mentioned collaboration too with businesses. What are some other key goals or visions that you have? And you can carry those forward too, obviously, but on your end stepping in, what are some of your goals?
So a couple of things. Let's just play out. You've mentioned it, but I want to fill it in with some more details about just dentistry as one example. So our responsibility is to train tomorrow's healthcare providers and work with them to retain them in the state, but also so that they're dispersed in a geographically advantageous way for leveling healthcare across the state. So dentistry. It turns out that nationally, there's about 60 dentists per 100,000 people in any community. That's what the average is. In Tennessee, it's 50 per 100,000 people. In Appalachia, it's 4 per 100,000 people. So we have initiative. It's a initiative that the legislature have helped us. Your colleague and my colleague and friend Phil Wenk's been right in the middle of it, as has our dean Jay Regain, called a Healthy Smiles Initiative, working with the Department of Health. And it's an effort to not only train more dentists, we're going to increase the number of dentists. So just like your niece, we'll have more colleagues, but we also want to not just do that in Memphis, but fan out across the state. So you remember I mentioned the 880 sites. Some of those are dental sites. We want to make more of those dental sites. And then we want to do more partnerships. So as an example, about a week and a half ago, we were with East Tennessee State University, and we're looking at some of the heart health, but we're also looking at with them and with Ballad Health and with a whole community in Kingsport. We're looking at seeing, can we develop more education and collaboration there so that we can offer that opportunity? Because we know that if we cultivate those relationships and provide training opportunities in those regions, people are more likely to go back to that region. We're looking at trying to do the same thing, obviously, with physicians and physician training. We train a large number of physicians, but we've got to work hard at retaining and providing the next phase of opportunities. So we're working on that. We're working with nursing. So I mentioned, for instance, the new campus, University of Tennessee Southern in Pulaski. Well, you can imagine Pulaski has difficulty training and attracting nurses because it's a rural area. We're actually working now that's part of the family. We're working on extending our BSN program so that we can provide opportunity and hopefully then have nurses rotate back to that region. And we have very strong relationships in pharmacy. So for instance, I mentioned that we have a campus in Knoxville. So we actually have a very large pharmacy training program in Knoxville. And similar, we have our training in Nashville, and some of our pharmacists train there. So we want to try to have that geographic distribution with really cultivating those relationships in each of the communities. So a large part of what our mission is to create a strong, vibrant workforce, also a workforce, quite frankly, that mirrors not just a geographic distribution of Tennesseans, but also the ethnic and racial distribution of Tennesseans. Because we know from national work that people who are of the same cultural background, they do better in care and they have better longer term outcomes if their providers are of the same ethnic or racial background. And so that's something that we need to definitely work harder on, and that can lead to better outcomes and reduce the health and racial disparities in healthcare that we see in this state, but are indigenous, sadly, across America. Clearly, we want to conduct research, and research from the basic research all the way up to the kind of so-called implementation science, where we do things that learn more about the conditions that are important in this state, and then that influence the treatment in this state. And we're very fortunate that not just do we have good partners that help us in training in their facilities all across the state and in Memphis, but also they partner with us and enable us to do research. Because you can imagine if you're just doing research in one clinic, you don't have enough people to be able to generalize what you find to an entire population. But if you can work with healthcare systems in a way that has full informed consent, and it has privacy protection, and the data is well utilized, you can answer big questions with big data in a way that can be more impactful. So we're fortunate to be able to do that as well. You saw us actually, and the community saw us combining our ability to influence care with also the use of data and to understand the situation in the pandemic, in the height of the pandemic. That was a great attractant to me to this job, because I could see the impact of the university and our faculty and even our students in training, it directly improving the healthcare in a moment of crisis. And it demonstrates what we can do, certainly in a crisis, but we need to do that beyond over the long haul with some of the chronic illnesses that are pervasive in this state.
Yeah, absolutely. Yeah, this is one of those, we'll definitely have you on a regular basis talking about all these very important topics. And so wrap up with where we can go to carry these conversations forward. So website, phone number, email, where would you direct us to go to carry these conversations forward?
So we have a fantastic, we've just redone our website. It is fantastic. You've got information about what we're doing, as well as who to contact, as well as if you want to be involved in something. It's a very good website. We're also on social media. And my door, actually, Jeremy, as you can see today, I'm easy, casual to chat with. My door is open. I'm available. One of the things that's really good when you come into a new community is not just here to circle the information and feedback of a circle of people that are around you, but get feedback from all walks of life, so that you really get a sense about what the institution is doing for the community, and maybe where it's falling short, or where there's an opportunity that we need to move into. So I invite your listeners to contact me directly, either by email or by phone. Both are available on the website, and happy to chat with anybody.
Well, the website is the initials UTHSC.edu. So University of Tennessee Health Science Center, that's UTHSC.edu is the website. Easy place to go and learn more. Dr. Buckley, congratulations. Welcome again to Memphis. Thank you for all you and your amazing team do. Thank you for coming on the show.
Privileged, Jeremy. Look forward to working with you over many, many years and making a big difference. Thank you.